It's my pleasure to welcome Dr. Nancy Poole, who's the director of the Center of Excellence for Women's Health, which is a virtual research and knowledge exchange center hosted by BC Women's Hospital and Health Center. Nancy leads network development, research, and knowledge exchange related to improving policy and service provision on a range of women's health and gender and social justice concerns. Nancy has also co-led system change initiatives and co-developed toolkits, training curricula, and guidelines on trauma-informed practice with agencies and governments across Canada. Dedicated to connecting across distance, cultures, and sectors, Nancy is a catalyst for bringing knowledge to practice and policy to make social change. Nancy was awarded an honorary doctorate degree in 2021 from the Justice Institute of BC in recognition of her contributions to women's health, including trauma-informed practice and the treatment of substance use and addiction. And I've had the pleasure of knowing Nancy for well over 10 years now. I first met Nancy when I did a policy research practicum at the center many, many years ago. And she taught me a lot about trauma-informed practice. And I've also been able to attend a trauma-informed organizations training that Nancy delivers at the JI, which is, of course, how we came to this today. And Nancy's going to give us a really focused training for our sector. So welcome, Nancy.
Thanks so much, Kate. Really happy to be here with you today and to have the opportunity to think about these issues. I'm calling in from the traditional territory, unceded territory of the Lekwungen speaking peoples and the Songhees, the Esquimalt, and Wasanic peoples, whose historic relationships with the land continue to this day. And if any of you are coming by the Victoria area, I'm happy to connect with people personally. I feel like we could use lots of face-to-face connections these days as well. So I'll have my email at the end for those of you who want to connect face-to-face or via email at the end. But as Kate said, I'm really hoping that we'll have the opportunity to stop and answer questions along the way. But I'll definitely leave the last half an hour open for us to have some discussion for sure, as well as opportunities as we go along. I have been thinking about these things with a lot of different types of organizations over the past 20 years or so. But really had the opportunity to think about trauma-informed approaches with the addictions field and be part of leading the development of that guide on trauma-informed practice. We still have hundreds of people download that from our website every month. So, you know, I just think it's so wonderful that people are still interested in these in what it is and to grow their practice on trauma-informed overall. The one in 2016 I did with MCFD around becoming trauma-informed as a full government department, which was really an interesting journey. And as Kate mentioned, I've done lots of work with the justice, public safety, and anti-violence community. Some of you may have worked on the committee that was part of developing this foundations course. And finally, in this past year, I've been really privileged to work with wraparound programs serving women with violence and substance use concerns who are pregnant and are looking for that kind of full support, and really done a lot of work on trauma-informed practice in that context as well. So lots of opportunities, and I guess your sector has been really thinking about this a lot, and I feel like others are joining the table. Of course, when we're talking about trauma-informed practice at the organizational level, we're kind of focusing in on trauma-informed, but we're also recognizing that these other, principles and practices of being harm-reducing and culturally safe and gender-informed, et cetera, are all really intertwined. And you'll see that. But I'm just going to try and hone in a bit on the trauma-informed part, and particularly on the cultures and practices at the service level around being trauma-informed, and particularly the worker wellness part. But really recognizing how, there's so many levels of work on trauma-informed approaches that we're involved in. And it's hard to pull apart to just do one thing at a time, but I'm going to try spend a little bit more time talking about being trauma informed. Offer examples of 5 or 6 organizations who have thought about worker wellness in the context of being trauma informed overall, and then to spend most of the time in that turquoise bit there around some of the core strategies around worker wellness within organizations that are trying to, be trauma-informed overall. And then finally, just open it up for discussion, as I said. And I just use that Pema Chodron's statement of start where you are as a basis for the discussion. And hopefully you'll have lots of things to say. So let's think a bit about trauma-informed overall before we delve into the worker wellness part of it. And I think I've showed this slide before when I've spoken to EVA folks about how, promising I think it is that trauma-informed approaches connect knowledge from really important different fields. And I think that really underlines why we're on the right track. Of course, our work about violence against women and safety is foundational to all other work, is a big part of it. But the wisdom from the Indigenous scholars and community-based knowledge keepers, I think, has really informed trauma-informed approaches by especially their focus on not going down the road of looking at things from a problem or deficit orientation, but looking at things from the place of resilience and how we can move forward by looking at strengths, not simply what's not working. The adverse childhood experiences people, I think, are so helpful to us because I think it reminds us that as workers, we have histories ourselves and a lot of health issues, that may be lurking for us as well around, over time experiences of trauma. And I think, I don't know whether any of you have read Gabor Mate's most recent book, The Myth of Normal, but I think he does a really good job of looking at how some of us store our trauma histories and how it comes out even as fully functioning, capable people later in life. And I'm going to talk a bit more about that part of it today. And of course, the neurobiologists have really contributed a great deal to our understanding and kind of validated it in a way that is kind of, 30 years of feminists saying, excuse me, violence against women is important, and trauma-informed approaches are important. But when the neurobiologists joined the table, suddenly it had more credibility because people could see brain changes, etc. But anyway, welcome and solidarity to everybody at the table, and really try and weave in lots from all those traditions. I'm just going to skip that one and just talk about trauma-informed practice overall, which is really, I think, well known by you all around, trying to integrate what we know about trauma into our service delivery and really try and do so in a way that supports safety, choice, and control so people can benefit from our services and we can deliver it in these ways. And that statement about it being a paradigm is really confirmed in both, traditional substance use and mental health documents like the SAMHSA one, and also by wonderful Indigenous writers like Suzanne Matho, who really also emphasizes this as an approach. But I like how the SAMHSA people call it as being as much about social justice as it is about healing. So just as reminders, as we're working in our organizations, we're seeing people who have many of these longer term responses to trauma in all of these different life areas. So it doesn't just look at that idea of flooding with recollections, etc., in the cognitive area, but touches all these other areas as well. And as you also know, that not only are we trying to see and respond to those long-term ones, but we're also thinking about how are we responding to people who have in the moment trauma responses, and recognizing how do we help them, regain the calm and comfortable place in the center in a window of tolerance, as Dan Siegel has talked about. And this picture on the right-hand side here is a resource that we put together with the YWCA in Toronto that the workers there felt was really helpful for themselves as well as those they work with around returning to a window of tolerance, and just some basic ideas about that. But I think, in terms of your wellness in delivering services, we are thinking lots more now about what happens to you as you continue to work with survivors, and what sort of cumulative effects does that have on you. And people have talked about it in this kind of a way as it builds, depending on your role and your own history and your own self-care, etc., that some of these kinds of issues can arise for you as workers, and really important for us to notice it and to be thinking about the self-care that is the focus of the discussion today. Just want to signal that lots more people now are also talking about vicarious resilience, which is the cumulative transformative effect on you of seeing people make change and move forward. And I just think it's a nice balance to always seeing things from the area of challenge. But anyway, these are the principles. I'm sure many of you have encountered them before that help us apply these trauma-informed approaches. We need to be aware. We need to create safety and foster trust. We need to offer choice and control. And we need to support the development of specific skills. And really today, I'm going to talk less about the work with clients and more about the organizational level of bringing these principles in at the organizational level, and within that, really thinking about your wellness. But there are lots of great resources around, thinking through how to be trauma-informed in general. And I just wanted to talk about those four principles a little bit more in terms of vicarious trauma and about your wellness. And, there's been some discussion over time by a lot of different researchers and clinicians about how important it is for you to be knowledgeable about vicarious trauma and to really understand how to do self-care and how to grow professional resiliency, etc. And that's what we're going to focus on today. Um, it's also really important for you to think about safety and trustworthiness in the context of your service. So to be really thinking about your own safety, and that when concerns about your safety are there for you, that they are acknowledged and responded to. And that there is lots of review of safety procedures, and lots of support through supervision and other methods around ensuring that you do feel confident and safe and secure in your job as part of your work. And, all the ways in which safety and trustworthiness can apply to you and the prevention of vicarious trauma for you. And, in general, people have talked in the literature about the importance of involvement of you in strategic planning and really having a common vision for the work you're doing in your organizations. And that's really valued. And when mistakes are made, that this is seen as common and and that it's a place for learning and working together to find further solutions. So I think it's just kind of interesting to really think about not only applying the principles at the level of the people coming for our services, but to really think about, as we're going to do today, what it is to support your personal and professional development and prevention of burnout and compassion fatigue and vicarious trauma, and your strengths to be really acknowledged. So that's just a quick, 010 of that idea of being trauma informed at the organizational level and what that looks like, and beginning to think a little bit about what that means for you. It'll be different for all your organizations based on your context and your leadership, etc. And I edited a book many years ago now called Becoming Trauma Informed, where women's organizations from across Canada just shared their stories of how their organization became trauma informed. And I feel like it's high time for lots of us to come together and do that again. But lots of different people have had ideas about being trauma informed at the organizational level. And at the bottom here is a picture from a group in San Francisco called Trauma Transformed. And they're amazing. They have the most amazing website and really lots of ideas about sort of collective thinking about being trauma informed as an organization, taking into account working on racism and sexism and trauma and many other of the isms together. They're an interesting and a really interesting organization. But they've also come up with this kind of picture of how, what what it means as an organization to be trauma informed, that central piece there, where, you know, there is a really clear understanding of trauma. There is culture, humility, there is safety, there is compassion and trustworthiness, there is collaboration, there is, you know, a focus on resilience and recovery. And I think it's kind of neat, their vision of that, moving away from being super reactive and not also necessarily expecting that your organization is going to be a full-on healing one. Although many of you may also be working in that place as well, but just really focusing on what that blue circle today of how staff and caregivers can really feel like they're honored within a trauma-informed organization. So I'll just stop there for a second and see if there are any questions so far about that presentation of what it is to be trauma-informed at the organizational level. Anything niggling for people? Anything that stands out that you want to question before we go on and talk about how some organizations have done this? There's Ninu. Hi. I didn't see you earlier.
Nancy, there was one question about whether you'd be open to sharing slides, because I think there were some graphs and visuals that folks
Oh,
would find really
totally.
helpul.
Totally
Awesome.
happy to
Great.
do
So
that.
we'll share those out after.
Yeah, meant
Thank
to be
you.
shared. And it's being recorded as well, and happy to have that posted or whatever you want to do. I know sometimes you know, something stands out that I don't spend a lot of time on, and I'm happy to share slides. Okay, so let's go on and look at a few things of what people did in trauma-informed organizations on their journey to really honor the worker wellness part of it. So I'll just go there for a bit, and then we'll dive deeper on the your organizations. So I put this together, this list, and I based it on another list that's online called Key Ingredients for Successful Trauma-Informed Care Implementation. I did it because I was working with some organizations who were working with people who use methamphetamine, and they were really trying to think about how they can integrate trauma-informed practice in their organizations. And you can download this from the Center of Excellence for Women's Health website. It just talks about all these different elements of being trauma-informed at the organizational level. And I'm going to focus on 5 and 6 today. But I just wanted to let you know that it's there as a full list if you wanted to, and can be printed out kind of like an infographic as a reminder on your wall, if that makes sense to you. I just want to give a nod to Sandra Bloom as I go along, because I presented with her at a conference on trauma-informed practice many years ago, and she has been an amazing thinker in this territory. And I liked her early commitments, the sanctuary commitments, where she focused on saying that, you know, it's important for us to be emotionally intelligent as an organization, to really honor social learning, to have open communication and democracy, and be thinking about growth and change, etc. Anyway, I highly recommend some of her books. This one is particularly focused on the organizational level. She talks about it as a new operating system in the book, and she talks about, I don't know if any of you were around when computers were first coming on the market, where we had these DOS things. You came into a black screen and you set up an operating system by typing it in each time. And she's suggesting, like, just get rid of that operating system totally and restore one that's built on these models. Anyway, it's a great metaphor, and I think really helpful to us. She's now offering the chance for training called Creating Presence, and that those are letters stand for commitments as well. But she is just saying that this organizational work is about protecting clients, supporting staff, and strengthening your organization. And she also talks about trauma-informed, trauma-responsive, and trauma-resilient organizations. So she's an interesting thinker. But here are the examples I thought I'd share with you. Here's one from a group in Philadelphia who prioritize staff satisfaction and wellness. They offer creative art therapy and other evidence-based mind-body practices, including yoga, dance movement, and stress reduction courses for their staff. So they're all in on this. But the other thing they do is their building has areas for staff to be alone or to socialize in small groups. They have on-site fitness and a kitchen, etc. But I think that idea, I've noticed in a lot of organizations I've talked to, is creating space for staff to regroup and to be alone, to actually, or to socialize in small groups, that we just can't be on all the time, especially if we've talked with someone who's having a particularly difficult time and need to just take some time to practice some grounding for ourselves. They have social groups where they talk about the topics. I mentioned before this idea of the isms of racism, sexism, and other issues, as well as practices like mindfulness, and as well as topics such as coping with grief. But they regularly screen their staff using a professional quality of life tool. I don't know whether any of you know about that, but it assesses employees on compassion, fatigue, and satisfaction, and burnout, and secondary trauma. And I just think it's kind of interesting that they think about that in a way that isn't punitive about that, but is really, they do it as a way of helping staff think about where they are and to notice where they are in terms of fatigue, burnout, and vicarious or secondary trauma issues. So I just think it's kind of this is a full-on example of people really being all in on staff wellness issues. And but there were elements within it I'm sure you could see yourself incorporating. And that idea of having, focusing on self-care as they do there, I think is really important. And just recognizing, I guess, that the professional sector is there, not just biopsychosocial, spiritual, as we've all been taught to think about, but also think about how our work life fits in. This is a bit out there. I don't know what you think about this, but this is an example of a women's prison who really thought about their staff in a different kind of a way. And they offered a lot of training in this prison on how to operationalize the trauma-informed principles. And they developed a mental health peer support program where both the women and the staff could have someone they trust to talk to, rather than being referred to an EAP program or a mental health crisis clinician in terms of the women. And I just thought it was kind of an interesting thing to think about peer support in that sort of conscious way. And I just had to point out that they offered dog training programs for the women in the prison. So women got to do something, learn a task in terms of dog training, but they also had therapeutic support service dogs as well. And in Canada, a colleague of mine, Dr. Colleen Dell at the University of Saskatchewan, leads this Pause Your Stress program and has a whole, has done a lot of work on the importance of using animals and other ways of self-care and trauma-informed connection. I have been part of a couple of research studies with her where we've looked at the benefits of those dogs within emergency rooms or with veterans who are having trouble adapting back to civilian life. We've done a whole series of ones about the benefits of dogs, and I just couldn't resist mentioning it. But they do have this group, I thought was just kind of interesting because it's not often that a women's prison would make this much effort to be trauma informed. And I guess I just wanted to inspire you that thinking about what your workers need can be done in any context. This gang from Toronto that I've worked with a lot as well and done research with, the Jean Tweed Center, it's an addiction recovery center, but I just wanted to point out that as they moved towards being trauma informed, they learned mindfulness practice as a staff group over a 9-month period. And then they had the option of continuing the staff to engage in monthly training and to think about how they could then integrate mindfulness practice within their work with women in the services. And, you know, they just found that there were lots of opportunities to pull out simple practices that could really benefit the women who are coming for addiction treatment, but also could reduce their own compassion fatigue. And they've written one of the best trauma-informed practice manuals for women's services. And I know it's about substance use, but it could really benefit overall for those of you thinking about the work with women as well as for yourself. So I think they've done a really cool job. This is another group, the YWCA in Greater Toronto, in a project we did over 4 years with them on becoming trauma-informed as an organization. And I just included this example because what they did was regular staff surveys about the integration over time. And I just thought it was kind of interesting. You can see there were 5 of them over 2 years. And they just asked staff on a regular way about you know, any shifts in the way they talk about trauma, in the way they're writing it, in staff communications, in any of in the ways that their frontline service staff have changed their practice, in their policies, procedures, the administration, and anything they've done around increasing learning resources. But, you know, they did a lot of other things beyond surveying, but I just think that it was kind of interesting because staff acknowledged that as much as surveys are not necessarily all that much fun, it did give them a chance to see change. And I'm going to talk a bit more later about how the research shows that when we can see change, it is really kind of protective of us you know, having vicarious trauma or secondary trauma or burnout or compassion fatigue. And so I just thought it was an interesting example. This is just an example of a full-on whole community in Newark, and Toronto, the city of Toronto has also done some work in this area of really trying to make a full-on trauma-informed city. And I'm not going to spend a lot of time on this, but I just wanted to point out that, you know, it's inspiring to think that we don't have to be limited to just our own organization, that we can be part of a larger work to be trauma informed across our whole sector or across our whole city or town, you know, and really thinking about how we can increase community awareness. In this case, they were really focusing on the developmental piece, the adverse childhood experiences, and what can be done to prevent and heal from early toxic stress, and what programs were available, etc. But they really spent time as well providing training and support to practitioners to improve their health equity in the course of it. And I found that when we worked with the Y in Toronto, they created a pamphlet as an introduction about their commitment to trauma-informed practice for their community partners and the employers of women who had come through Y programs, et cetera, and also for new staff, et cetera, and current staff, of just writing it down in a pamphlet. Was just kind of another interesting example of how people are trying to bring in this work to their practice. This is crazy, but I put this in because when I was working with MCFD, I really tried to talk to them about it being bigger than just the individual interactions with families. To really think about worker wellness and systemic change, and the importance of having a culture about being trauma-informed, and really supporting training and learning and talking together and talking across service areas, talking across sectors, and really thinking about, you know, how do we have a discourse about improving safety and collaboration and connection that, you know, it can really be called relational system change, not just, you know, improving individual practice or individual staff's health and prevention of burnout. And, you know, in the area of child protection and children's health overall, I think there was so much challenge for the workers and so much turnover and burnout, and really engaging them and thinking about what does change that. And, you know, when I was working with them on this manual, they had a lot of challenges initially, or resistance initially, to talking about the worker part and the system part. They really, you know, our work is with children is paramount. And I'm just saying, but you can't do that work with children unless you're healthy and have healthy workplace cultures, etc. That is never going to be sustainable, and you're just going to continue to see people burn out. And so I did manage to open the conversation. I don't know how far it's gone. I've put the question mark there, as I'm sure lots of systems still have things to learn there. I actually, that manual you can download if you're interested, is called Healing Families, Helping Systems. So I did manage to get helping systems in the title. I actually encourage them to think about it the other way around. And that's what I'm going to talk about to you on the organizational level today. I wanted them to talk about it as helping families and healing systems, that really the healing work needs to happen at our organizational level and system level, not in the only in the interactions with the women who and others who come for our services. So that's just some hopeful inspiration of how people went about it. Let's talk more deeply about worker wellness strategies. Whoops, I spelled within wrong there. In trauma-informed organizations. I'm going to talk about three things: self-care, debriefing, and workplace supports. And let's start with the self-care. And, I'm sure that lots of you are really well aware of, things like these models like ABC, that it's important for us to be attuned to our needs and limits and emotions, to balance the multiple aspects of ourselves, and to be connected to others, not only to ourselves and to our life purpose, but also to others. And, I think in the past, sometimes people have really put down self-care as, kind of too individualistic and too self-indulgent or whatever. And I just want to point you to this amazing manual called Caring for Yourself is a Radical Act. And when I share the slides, you can find if you haven't already seen this, the link to it. But it includes a quote by Audre Lorde, who says, caring for myself is not self-indulgence, it's self-preservation, and that is an act of political warfare. And I just kind of like that as a statement of how important this part of it is. And of course, self-care has to be nested in an organization that creates space for that. But really, ultimately, really seeing self-care as a radical act, I think, is an important thing. Just want to point out that there are many ways of self-care, and part of the work for Indigenous women may look very different in terms of finding self-care that makes sense, whether that be drumming or being on the land or storytelling or many other ways beyond Western approaches. But I think one of the most important ones that has been brought forth around self-care is mindfulness, as the Jean Tweed Center did with their staff. And, I just put a couple of points down there about what mindfulness is as a reminder. It's a process of enhanced self-regulation that involves paying attention to what's going on with yourself, accepting yourself in the present moment, and really bringing non-judgmental attention to yourself. And, the benefits they've seen are lots. There's so much evidence now around mindfulness as a really important thing. And I don't know whether any of you have read Tree Levin's book that talks about adaptations for trauma survivors when doing mindfulness. He's a really interesting person who's thought through some of that. But I just thought it was interesting that people are creating apps. There's so many helpful apps. And here's an example from Western Australia around Indigenous women creating a mindfulness app in their language. But not only mindfulness, but grounding is really important, not only for sharing with clients, but to practice ourselves. So grounding and self-calming, self-compassion. I recently read Dr. Kristen Neff's new book. I don't know how many of you have read it, called Fierce Self-Compassion. Really worth reading and sharing with women that you know. And I think for me, it's about what we're doing today is sharing, creating space to discuss and practice these kinds of things together. Two of those things, the grounding activities and the alternatives to using cannabis, that includes information around grounding and mindfulness, are on the Center of Excellence's website. And the bottom one, the safe coping skills one, is a handout that was created by Dr. Lisa Najovitz that can be found. You can order from a store at seekingsafety.org. But it just offers so many ideas around coping skills rather than just thinking that grounding or mindfulness is the only way. It really gives affirmation statements, ideas about self-care. So the second part I wanted to talk about after self-care was this idea of debriefing, and to just talk a little bit about how we do that in our organizations, and to recognize that we need to think about consciously about how we do that. And this woman, Françoise Mathieu, has done lots of thinking about low impact debriefing and really emphasizing this idea that we need to make sure that the person we want to debrief with gives consent for that, because they too may be overloaded that day, and it just compounds trauma rather than being helpful to either you or them. And so, there's lots written about it. I just think it's kind of interesting that she is saying, as we debrief with each other, we need to think about how much detail we need to provide. And we need to be able to ask for and get consent for people and regulate this process of thinking through what has happened, what it means, how do we integrate it, how might we move forth. So really worthwhile on that colleague to colleague level. But I also think as a group, we can really be thinking about debriefing in our organizations and using these questions that some obstetricians, believe it or not, came up with, of coming to debrief as a full team in a regular way that isn't just debriefing about a problem, but is debriefing about how are we doing on trauma-informed practice, or how are we doing on creating opportunities for self-care. So here, it just gives 5 questions. What did we learn? What's gone well? Do we have any system issues? What would we do differently next time? And who's going to follow up? Anyway, I just think it's kind of helpful to have some questions to begin with. I just wanted to throw in a quick mention of trauma-informed supervision, because I think it's really key to worker wellness, that we examine the way we're supervised and do supervision. Here's 2 examples on this sheet. One is the YWCA in Toronto, again, that project I was involved in, where they just take the 4 principles from trauma-informed practice and apply them to supervision. And on the other side is actually a sexual assault center in Pennsylvania that created a really great resource on trauma-informed supervision that I think works really well. But I also talk about this in the courses I teach at the Justice Institute, that this peace approach that is often used to enact the principles in interactions with clients in terms of thinking about predicting and preparing about what we're going to talk about, enlisting ideas from our clients, acknowledging strengths, creating opportunity for choice and control, and explaining next steps, can really also apply to supervision. It's a very simple model of thinking about how can we better create this space for trauma-informed supervision. And again, just kind of emphasizing that creating this idea that even if you want to come into the supervision and talk about how much challenge you're having with secondary trauma or burnout or whatever, that this not be seen as a mental health problem, and unless you want it to be, but to be seen as something that's common in our services, and that thinking together about how a personal wellness plan could be brought into practice that could really support you. Just gonna mention, of course, the fabulous Vicki Reynolds, but to mention that a lot of the work on burnout and compassion fatigue and secondary trauma focuses on it being a problem, but she and others like Hernandez have really talked about connection to our clients and that idea of vicarious resilience, that when we're able to stay connected and experience, as Vicki talks about, the zone of fabulousness, that is when we don't burn out. It's not that we're exposed to people with trauma histories, is that we're not able to connect and walk forward and see the change and be part of the change with them. So really, really thinking about what that means. And she also stresses that idea of collective care, not just self-care by itself, but collective care as a group, and doing things like the 5-question kind of debriefing, etc. So there's tons of things that the organization can do: give you access to counseling, give you sufficient training and supervision, create that democracy, that chance to provide feedback and be involved in decision making, to create actual wellness initiatives within your organizations, change debriefing practices, create opportunities for self-care, rooms for that, or Friday lunches or whatever, to, where people can take time off and do things that feel caring to themselves. Tons of other things: paid leave, trauma-informed supervision, et cetera, et cetera. So I just feel like there is then that personal self-care, the debriefing with others, and then the whole on organizational piece being helpful. And I just wanted to mention the leaders in the organization, and, you know, glad to see Ninu here. I'm sure others of you are leaders in your organization, but this work from Trauma Transformed, the folks in the Bay Area, as I mentioned before, they've written some really interesting things about leadership competencies. And so what do leaders need to be in organizations that support self-care? And, you know, again, communication, inclusivity in decision-making, mindfulness, being willing to deal with complexity and tolerate that, and to really think through how complicated things are, to support critical self-awareness, and really thinking about how do we think through how we can improve together and be and use appreciation, etc. So I just threw that in for the leaders in the group about those practices. But to sum up, this work from Trauma Informed Oregon, which is another website I highly recommend. They have so much great information on it. But they mention that they've done research there about what are the strategies that mitigate the impact of working with survivors of trauma and adversity. And look at the top 2 of these. I think it's so interesting. Team spirit. that we need to feel part of a team and having social support in our organizations can really buffer workplace stress. And secondly, that piece that I was talking about of vicarious resilience and the zone of fabulousness and whatever, but seeing change as a result of your work, having tangible evidence that your work is important and helpful. And that's because you've created those debriefing sessions, or that you've done the surveys like the Y did, or just a feeling that you get because of your daily work. But I think those two just stood out to me as so important and so kind of feminist in a good way, right? Or collectivity and social change orientation as being really protective and part of wellness. And of course, training, supervision, a balanced caseload, so you're not only doing one thing, constantly talking to people, but that you have other aspects of your work. And they mentioned stress inoculation training. I'm not quite sure what they mean by that, but I think it means practicing dealing with stressful situations. And that may be helpful too. But their ideas for workforce wellness really touched on some of the things that you saw in the organizational examples: space for self-care, lots of staff appreciation, wellness plans for everyone, trauma-informed supervision, work employee assistance programs for those who want to go on and get more, full-on counseling, and workplace wellness rituals. And, again, trauma-informed practice doesn't end up being rocket science. It's such clear and possibly able to do. Let's do it. So, yeah. So that's my summary, self-care, the debriefing pieces, and the workplace supports, adding up to worker wellness in our organizations. The start where you are is, I just think gives us a chance now to turn to talk about where your organization's at and could build forth. And just want to mention there's some handouts on my site that can give you some startup discussion questions. And also the Canadian Public Health Association also has a really great toolkit that talks about how you can support staff development and build a plan in your organization overall. But just really wanting to honor that this is really important. We are in a time with such chaos around us and so hard for us to hold our health in order to be able to help people. And I just can't think of anything more important than this topic. And really want to encourage you to talk now about where we might go forth from here.
Thank you so much, Nancy. That was amazing.